Everyone, I've been traveling, so just out of precaution, I've been in airports, so it's just safer. So there's just cases that are just peeking out and peeking up in different spots, so. But let's get started. So I think we do have a quorum today. Yes, so great. So we'll call the meeting in order. It's 5:31 PM. First order of business is approval of minutes from July 17th, 2024. Do we have a motion to approve or any points to discuss?
I'll make a motion to approve as presented.
Second, any second?
I'll second.
All in favor?
Aye.
Great, so it's passed. All right, so we are gonna have received some fundraising updates that's based off of what Stephen has also sent us and a bit from what Emily is going to share. So I'll turn it over to you, Emily.
Fundraising updates. So currently we have waiting, on the sidelines is an approval for the burn request that Steve, very kindly wrote and submitted. After running it through Ed, our town manager, Ed signed off on it and it was mailed out, and a $30,000 check from the Burn Foundation has been received. It has not been approved by the select board. I don't see why it would not be, but that is usually,
There's
that's,
gonna be a public hearing.
there will be a public hearing, et cetera. So like, it's not posted to our fundraising as of yet. After it is approved at that meeting, that is
Yeah.
when I will get all of the finalized information and
Ooh.
the thank you letter can be sent, et cetera. So that's the formal process, but obviously it's excellent news and I wanted to share.
Remind
that
me
with
what our
you.
goal was? Wasn't our goal around that mark? Maybe, or close to that, or at least what we needed to cover. I don't think it was our goal, but we needed like
Right.
30,000 for 1 year,
Yeah,
right?
we needed at least 30,000, so yes.
Very
So
cool.
again, that has not been, it's not official because it is not approved by the select board. There is a public hearing coming up
September 3rd.
September 3rd.
Okay.
But thank you again to Steve for taking the reins and getting that drafted and out. I mean, that made that possible, so thank you. And then Steve had been working on an outline for other applications. So we had discussed at the last meeting, kind of what the deadlines looked like, who would take on some of the responsibilities for those things, what kind of applications they are.
Yeah,
Just so that all of the members of the committee are familiar with them. Some of them are sent in via letter, like the Burn Foundation. Others are just kind of a web form app where it's almost like filling out a Google, what do I want to say, like a survey kind of thing,
Right.
where like that's where you're submitting your information.
Right.
So it's not something that necessarily all of the members of the committee will see as that process is completed, but just so that everybody is kind of aware of all of those pieces, this I put into the meeting packet what the outline is. So obviously the Burn Foundation is part of that. The amount received that's indicated is actually the amount that was received last year when the ad hoc committee had applied.
Okay.
Steve had expressed that he would like to apply for basically twice what had been received in the last year, to hopefully at least get what we got last year, possibly more. That was his approach. And let me see, there were no other. He did provide a brief follow-up for the Hope Foundation as requested. There's no others that require a follow-up report that are noted. Yeah, I don't know. So I just figured that would be presented to everybody so that everybody can full transparency, see what we're looking at, what will be applied for, if there are any questions. I don't know if Steve needs any help or support in the process. I know he can't be here this evening, but that is just something to throw out there.
yeah, so we'll just defer to Steve.
Yeah.
Did the committee receive, did we receive I know I saw it, but did everyone else receive his sort of write-up, or is he gonna present that the next time?
So it's in the meeting packet for
Okay,
tonight. I
so
did
yeah,
get
so
his,
if folks-
so I requested his
Yeah.
direct approval, just again, so
Yeah,
that everybody
so-
in the committee can see and be aware of kind of where things are going, what those communications are. And he wholeheartedly supported kind of just offering this as, here's where we are, here's the proposal to go forward. And I believe he had offered at the last meeting to be doing these applications, so.
Yeah. So were folks able to review it, or do you wanna take a second to look at it? I believe it's right after the minutes, from last time. So it's that one pager where he lays out the name of the foundation, and then the amounts, and the type of application. I'm happy to help as he, and I'll let him know the same, but, when he's here, but, so I'm happy to support in whatever he might need.
So he can just move ahead with these applications then?
I guess that's what I'm putting forward to request of the committee, is this
Yeah.
is what he's outlined. Is everybody,
Yeah, so
satisfied with that approach and that idea and move forward? That's-
Cindy?
I think it's a great idea and I think he's all ready to go. I
Yeah,
don't see any reason to wait unless.
I would just make sure that we're working together with, the town, so working together with
Yes.
you and Ed
Yep.
as we're signing these off.
and Steve and I did that well when we did the burn letter.
Yes.
I was able to present something to Ed. He had a little bit of feedback. We
Yep.
made that adjustment and Ed signed it and
Yeah.
I got it sent out right away, so.
So just so the
I think we
committee's
have-
aware, we're
Yeah.
not, we don't need to be in the middle of that, and if you're okay with that, then we'll just leave that process as is. All right. Okay.
Quick question.
Yes,
Yeah.
please.
Does Steve know about the Mrs. Byrne check?
Yes.
Oh, excellent. Thank you.
I knew he wasn't going to be able to be here, and I was able to communicate with him that, again, kind of the same spiel I give, where like, hey, this is unofficial, but here's where we are, so, yes. Where is he?
Says he's sitting on the Teams meeting waiting to be with him.
I don't know that he is on the correct one. I don't, because when
Okay.
Kristen asked to come in, it popped up.
Okay, no worries.
So I could try to make sure that he has the correct, unless I'm missing
No worries. Let me see what I can do.
something on here.
Don't let me hold you up. Let me see what I can do.
Yeah, it popped up the last time someone asked to be let in,
Yeah, no one.
so I should
no
be
one's on
receiving a
here. Yeah.
notification.
All right. Great. Anything else about fundraising? So we'll also just, when Steve is back, we'll just anticipate hearing any other updates. It looks like some of these that are sort of rolling, or, maybe the next one would be the Hope Foundation, it looks like. So we'll just assist as he needs, but it looks like he's put it, well, I don't know if he's updated the responsibility line, but he's noted himself as the responsible party for that, so. All right, we'll move on to communications. So we'll talk about the mailing updates, Emily.
So I received a quote. So I was looking at what our overall budget for the mailing is based off of what we've received from Alice Peck Day and Community Nurse Connection. And I am confident we'll have plenty to cover the costs that are associated. I did get a printing cost of $520 for 2,000 5x7 double-sided gloss, et cetera, et cetera. So, it would be $520 for the printing costs. And I did try to check in with our postmaster. The person who has the most experience with these bulk mailings was not available. So I'm gonna go back on another day when that person is working to try to get a little bit more specific, and hone in on how much the actual postage is going to cost. But knowing what our budget is, I'm confident that it's going to fit within the budget, being aware of other mailings that have occurred. And then as far as the actual,
Sorry, what's our total, what is our total budget again, just a refresher?
it was
I know we received the
$3,250.
Okay, okay,
So, and then when we take away, the estimated 520 for printing, that leaves 2,730.
and that already includes what we received from the Nurse Connection.
Yeah, so that includes the APD grant and the Community Nurse Connection
Okay.
grant. So we have, yeah, so we have room to be able to work with that. And I
Yeah.
know the quote that I had received from someone else who had done a mailing was below even that.
Right.
So, I'm confident we can fit it within the necessary budget.
Great.
As far as the mailer itself, so we have an opportunity to receive feedback before we go into the development process of the actual visual. I know there was concern for what it would look like, how we make it represent Enfield, and so I, just based off of the timeline of when I was in touch with the person who will be drafting it, it made sense for me to actually come before the committee and ask if there is direct feedback, if there, what is it that makes it look like Enfield? What makes it have that feeling that could help us kind of really try to hit those points on that draft that we'll be presenting at the next meeting. If there isn't any kind of direct feedback, then we can come up with a draft, but I thought it would be best to try to get information as to what people would expect to see prior to going into that process.
So I'll open it to the committee that's in here today. Obviously, there's just a few of us, so Donna or Cindy, any thoughts on? So this is the postcard that will go out, in our sort of I'll call it our Thanksgiving or pre-Thanksgiving campaign, that is both educational as well as, hey, if you want to donate. By the way, not to get side, any updates on the QR code? Before, yeah,
Yes, so I am actively working on it with the assistant town manager there. It's a process of, oh, there was an account created. It was created under someone else's name, but for
Oh,
the
it's
town, and we have to,
experienced.
like, it's, yeah, so it is in process to be able to do it.
So hopefully there's enough time between now and,
Hopefully there is. I have a proposal for a workaround if absolutely necessary. It would require approval from the other 501c3 that would be involved, but I do know that they have Venmo and PayPal set up. They are a certified 501c3 and would possibly be able to be a collector,
right, and transfer.
to be able to cut a check to the community nursing fund. And it was kind of one of those last ditch effort to try to make it as accessible as possible. So it's just an idea to throw out there that if for any reason this cannot be that avenue, maybe trying to work with a 501c3 who already has those things available, maybe in the committee specifics.
'cause
Just as an
yeah.
idea.
Because one of my suggestion is regardless if we have that or if we don't, then the main option would be to direct them to a website and or to send a check, like to a physical check that they would have to mail. And I imagine that would go to the town. So we would need to make sure, please write a check to, and those specifics that would have to go in that postcard. So that'll eat up some more space, but I mean, either way, I would suggest having that anyway, because there are folks that prefer to write a check and they want to be able to mail something like a check somewhere. So that just as long as we have those specifics, who, attention to who, and then the whatever address that they need to send it to.
Okay,
What's the size of the card again?
5x7,
And it's glossy or?
glossy, double-sided, full color.
And it'll have the mailing, information right on the card. It doesn't need to be put into an envelope or anything.
Correct.
Okay, yeah.
Emily, is the 501(c) identified, or we would identify any 501(c) if we need to?
So I'm associated with multiple 501c3s, and one of them, we just did a fundraiser for a local family. And I did the exact same thing where I created the Venmo and the PayPal to make sure that everything was easily accessible. And so I know of at least one that could be but I mean, there are there's more than one 501(c)(3) in the area that may be able to help us with that.
Yeah.
I mean, I work with the Enfield Police Benevolent Association. And we just did a major fundraiser, and so it's one of those things where, like I said, if it's the difference between having a QR code and not having a QR code, I would like to have some other ideas of what we may be able to manage. If the committee would be happy to do something like that, again, if push comes to shove, if we can't get it through the town, if others are open to that, then I can bring it to the Enfield Police Benevolent Association and to the president to try to see if that would be a viable option.
Yeah.
Okay.
And just based off of the fundraising that they do for the community and the bingo and things like that, it seemed like a safe avenue to try to explore that. So,
Yeah,
speaking on behalf of them, it's just an idea.
yeah, I'm open to
Okay.
if Enfield, the town, isn't able to obtain, I don't know that we have to vote on it right now, because it's just a conversation, but
Right.
I'm open to if any of the nonprofits, and especially it's tied to Enfield, the Enfield Police, and, you know, any 501(c)(3) that's local in Enfield that would be willing to help us, that would be great.
Mhm.
I know that sometimes there's fees associated to that, so I'd also want to be transparent and, you know, making sure that they're not, you know, that they are aware of that, as well, so that, and that folks are also, that we're aware of that.
Mhm.
So going back to how do we, what are the thoughts as far as this, before this, gets presented to us in the next meeting? What are folks' thoughts on making sure that it speaks to Enfield or it feels like Enfield? Any thoughts or feedback on that?
Well, you know me, I like sort of straightforward, friendly, something, you know, that is not complicated. That talks about what, community nurses do. And, the actual fundraising part, there's not much to say, but I think we should use a fair amount of the space to talk about what community nursing is and what it would mean. We had a flyer that we had before, remember, Emily, it folded out into like 3 or 4 sections, a mailer for fundraising.
There
was- I think, Harrison had come up with it.
No, the
I have a
trifold
copy
was
of it.
from Lebanon, and then we had a rack card. There was the double-sided rack card.
Yeah, and there was another thing that Harrison was using for, fundraising that folded up into a business size envelope, but I think it folded twice.
Right,
I don't think it was a trifold.
We sent out letters.
Yeah, and it had a tear off thing at the bottom to put the amount. and who you went. I
Yeah,
didn't
it was
bring it with
just
me.
a letter. Okay, yeah, gotcha.
And I don't know if we'd want to use the wording that's on that. I can take a look at it when I get home.
For me, one thing that comes to mind is making sure that in the language that there's, you know, that it's called out that it's a free
Yeah.
service or at no cost. The idea that it's convenient, it's there to help you, you know, so keywords of no cost, free, convenient, no pressure, just, you know, and even making it more casual, because I think some folks, it could be daunting if they think it's something complicated. So I guess for me, the tone, that kind of tone might help.
Do we have
Some-
room for some kind of photo on it? That would
Yeah,
show,
I
you
don't know if you would.
just
kind
a
of-
person in their home or with a caregiver, but even just a person in their home. Cause I would need to be kind of small. So you get all the wording in.
I think,
Or-
I guess the
or-
question would be if we have a photo that can be used and if it,
Not currently.
yeah.
We may be able to take one between now and then, but we don't.
It might be nice if it is someone that is part of the, and like part of the community.
Yeah.
All the
because then
photos
there's
we have
some-
now, we don't own. That's the problem.
Yeah,
Okay,
They
that
were all
was
taken
my
by the
indirect
county.
question of, okay.
Or maybe even the group photo or what, like, maybe it doesn't have to
Yeah.
be with the client, because sometimes it's just putting a familiar face that these are our, I mean, I know it might change, you know, I'm not saying this is forever, but for now, these are the faces of the folks.
Or even, yeah, I mean, we can do that for sure. That's easy.
Yeah.
Worst case, you could do something like the proposed flyer and just, use some hand imaging. And you could always make it a watermark so that the photo's the whole card and then you write over it.
Yeah.
If the
Mm.
colors are right.
I would err to the side of photos of you guys, because I would know what a watermark photo is. Like, I would know that doesn't exist.
What do you mean?
Like, I would err with real people, so like a group photo of our actual nurses. Even if we have to stage one, I'm like happy, like, if we need to stage one.
You mean real as opposed to?
As
going
opposed to
online
like
and getting
going
a
online
canned
and
one
getting,
that-
yeah, because if we're talking about like. You're trying to, what I'm hearing from what I've heard in the past is how do we make it Enfield? So if you're trying to make it Enfield, then you need to show the folks, I think, that's gonna be visiting these people's homes, because if trust is a big barrier or trust is a factor,
Mhm.
showing faces of potentially who the other person is on the other line would mean a lot more than
Mhm.
someone that I'll never meet.
Well, maybe one of the nurses would know somebody that was approachable that they've seen in the past, since they started, that would pose for a picture in their home.
Maybe, we're probably better off to just fake one. But yes.
With whom? I don't know.
Oh, just like
What
an
do you mean by that?
online, I guess it's just.
No,
like-
no, we
Oh.
can take a photo, just like find some person to pretend to
Oh,
be a
yeah.
patient.
Yeah,
Yeah.
that would be fine. if
Rather
we're
than
agreeable
have
to
a
it.
real patient and potentially, I mean, we have a release all written up that obviously we would have signed, but still, they can revoke it at any time, and if the
Yeah.
mailers go out and then you reuse it after they revoked it, we're better off just to have an actor play the
That
patient.
would be perfect, I think.
Probably somebody not from Enfield because
Yeah.
people are gonna like, that's not a real patient. That's
Oh, they'll say, what's wrong with her? I didn't know she needed a nurse.
Well, I'm happy to volunteer my parents if you need one. They're in Canaan, so.
There you go.
Oh,
I
okay.
mean,
We do a lot of that. A bunch of our photos are of people's parents
yeah, so I'm happy if you.
that aren't
want,
seen by the program.
I'm happy to.
We could get, would it be appropriate and would we have a testimonial from anybody?
Yeah, so all of our, 3 times annually, so we do 5 reports currently a year. Every one of those has a patient testimonial already attached. And I'm not sure, oh, no, we're not. I was about to say, I think we might be using an Enfield one for the report that's about to be released. But it got bumped. So we will be, that'll probably be the next one. But they're not, like, nobody knows the geography of them when they
I think.
come out. So we've got,
Yeah.
my point is, we've got a bunch in the can.
Yeah.
We can very easily ask the nurses to write another one.
Mm.
Yeah.
That's not a
I
very,
love that. So I envision like one side of like what it is, and then the other side just purely like how it's impacted their lives or how it's
and
impacted.
we can, Kristen, I don't think you've got any specific, I don't think you've got any from Enfield yet. But you
I
could
think we
probably.
do. I can run a report from the client satisfaction survey with some testimonials. And it won't be tied to a patient name. I can just give the committee, when you're ready to print, when you're getting closer, like a whole list of all the comments, and you can pick what you want. It won't have any names attached to it, any patient names.
If you could email it to me, since I am working with Hillary for the draft to be presented, and then that way Hillary will have something to choose from as far as like, how many words can we fit in this space?
Yeah.
And if we can fit more, then we'll use more. But if it's really more of a short
And-
snippet that we can put in one area to highlight, then.
She's
we can-
really good. in
That would be
the-
awesome. Thank you, Kristen.
In our semi-annual reports that we do as a whole, that's exactly what she does, is she takes quotes from the patient satisfaction surveys and just like puts them in the margins and spreads them out throughout the document. I
Yeah,
know we're talking about 5x7. That's not exactly how that's
Yeah.
gonna work, but
but still.
Well, and that was the one thing that crossed my mind as we talk about photos and all the things that we want to put on it. It may be in consideration whether 5x7 is going to accommodate all of that or not. I wonder.
I guess it would be, yes, go ahead, Cindy.
I think we should try to keep it to 5x7. Is that what you mean?
Yeah,
Yeah.
yeah, I guess is, you know,
I think we should tailor the content so that it fits onto there.
okay, that's fine.
Yeah, I
That's-
mean,
yeah.
even if like,
that's
for
what I
example,
mean.
if the first page where the mailer is, like the person's address is, that could be all the different quotes, or like that could be the different remarks from folks. You know, and then the second page could just be
Yeah.
fully like a photo, and then layered on top of that is the writing. So
Yep.
that the photo's sort of like a background, you know, piece.
Gotcha.
Yeah,
Okay.
because you don't have to just waste the one side.
Yeah, cause the mailer,
Address
front,
and
yeah.
mail.
Yeah.
And that might be catchy, cause like when you see it, it's addressed to you and you see all of the different comments and remarks people have about the program. Then you turn it around and learn more.
Awesome. And I trust Hillary's experience with developing those, so she'll have a good idea of the layout. So, okay, great. We'll stick with the 5x7. I'll keep these comments to send off to her, and I will look for Kristen's email and,
And what is our timeline now on this, on the mailing? So,
so it will be approved at the September meeting to be printed, and then it will move forward. Basically, it'll just be in waiting until the timeline in which it needs to be mailed to arrive for the timeline in which we would like to. And there's enough of a buffer that we could wait until October for printing if absolutely necessary. I would definitely like to be a little bit ahead of the curve and aim for September, okay? Because September approval of the committee for the concept and design, we're already 3 weeks into September, so that feels
Yeah.
like kind of like we need to be finalized then
Right.
and then move on to the printer.
So should we suggest, would Hillary give us a timeline of when she can have a draft of it before the meeting, or will we be looking at it for the first time during the meeting? Cause
Well-
that could change too, like if you see it during the meeting and you have edits, you know.
Yeah.
Could she send it like the Friday before the meeting so folks could truly give their feedback over the weekend, and at least coming to this meeting, she could already have that, as opposed to she would have to wait for us to discuss it in the meeting here. Either way, I guess there's enough time. I'm just trying, whatever her timeline is.
I
would
think
be-
that would be a good idea.
good
If we
to
could
know.
have some, like a two-stage process there for feedback instead of putting it all into the one meeting. I mean, because I don't know.
I'm just worried about one person receiving 7 separate emails from individuals with feedback and trying to fit all of that into one thing, because you know, your vision may be slightly different than my vision, may be slightly different from so-and-so's vision. And so instead of having one collective conversation, we're now breaking it out.
Yeah.
And that may create more work than it actually helps solve the problem. But
Yeah.
I hear exactly what you're saying, and I agree. Like, I would like to have feedback, but I don't know that that is the dynamic approach to being able to get 7 people's feedback and having that.
So will we get ahead of?
Since
Yeah, go ahead,
Hillary's done this a lot, could you ask her if that would be helpful or if that would just be more confusion?
I mean, I can
Because
ask
if she
her.
thinks that that would work for her, 7 doesn't seem like that much to me, but
I think given that,
comments.
based
She's
on the
also
previous
not a
meeting,
town employee who is doing it for us, and I would like to, she's not a town employee who's doing this for us, and so I would like to be respectful of her time in that sense. And so, yes, I can reach out and ask her, but I'm not gonna have feedback from her until after this committee meeting is over to disseminate at the next meeting. So it's hard to,
she's a resident that's volunteering to do it.
Right,
I was just gonna say, given the deadline, or given the timeline that the committee's discussed sending the flyers out in, I don't think that there's any reason to rush. I think that it makes complete sense to get it to the committee before the meeting so that you have time to digest it rather than, I mean, personal belief, having served on a bunch of these sort of things, I never want to see anything for the first time in the meeting.
Yeah,
So get it ahead of time so you have time to digest it, makes perfect sense. I don't think that it makes sense to have a lengthy email conversation about how to change it.
Yeah.
Just having worked with her a lot, she's super receptive and she'll try to make all the changes.
Yeah.
And I feel like that could very easily be overwhelmed.
I think that makes sense. Cause
So I
then
think
everybody
receiving
can
it.
like, cause then we'll be able to have the discussion about it at the meeting, come to consensus.
and I will do my best to have it out, because I have tried to get the packet out to everybody the Friday before the meeting. It doesn't always work based off of waiting on some information or a point of
I think
contact,
with
but
her, I
I
think with
think we
her.
can manage to
Dig on
do
me.
that. What? What'd you say?
I would
Said I think
say,
that was a dig
I
on
would
me.
say, I think it's,
No.
I think it's less the whole packet, but if, whenever she's ready with it,
Okay,
just email it out, even if it goes out on its own.
Yeah.
I'm
Yep.
okay with that, and I would just say, folks, hold your replies, hold your comments until we meet. So if she's ready 2 weeks from now, then great, we'll receive it 2 weeks from now. And then at the latest, you could let her know the Friday before, I guess the Thursday before the meeting, if you want to get it.
The other thing, just food for thought, is you're walking a fine 91A line, right? Like, it's a mailer, it's not an important decision. She's not a committee member, but still, like, it's toes right up to the line.
well, and again,
If
it's
everyone were
respecting
just
her
communicating.
personal needs and privacy and professionalism of kind of where that boundary is and not crossing it as far as the time that she is giving to us. Okay,
Any other questions about the postcard?
Emily, I just sent you a couple of comments. I had to take some off the report. There's one really fun one I'll share at some point with you, but it's not appropriate for the mailer. It has,
those are my
it has,
favorites.
has an inappropriate word in it, but it's pretty funny.
All right, so let's move on to Cindy's flyer. I know Cindy, last time you wanted to have some time to discuss it, so the floor is yours.
I just wanted to know if I can use this for outreach. I made corrections on it from last time.
I hadn't received the most up to date, and I meant to say that. But yes, I didn't have the most up to date version emailed to me, so I couldn't include it, but I just included it for the purpose of conversation and context.
So the one we had in our packet is not the most.
It's not the most up to date.
That's
Yeah,
what I thought,
I don't have a copy
I
of that,
passed
so
it out at the last meeting, so.
Yeah, just an electronic copy. Yeah.
I need an electronic copy.
Yeah. Okay.
All right, I'll send you the electronic.
So I guess really the question is using this for outreach. We have both, we have the other as well. We have the one, the community nurse one.
Trifold.
Right, mobile health, community nurse, and then Cindy had talked about using this as well, to have available. So the one pager and fields. At events, right? That sort of thing.
Yeah.
Right, events and.
Is this something that should be considered in the cost of printing materials, or is it more like an email distribution, or?
And there were a couple corrections just to this little thing.
This is the up-to-date one, huh? Oh,
No, I didn't
I've got-
check it for that.
gotcha.
My thoughts are, I guess. We have the official trifolds from that gets sent or that's used at all the locations. So I'm fine with using that. If we did have our own event, meaning like we're tabling those events, we could see how this is received. I still just want to make sure that the Community Nurse Connection folks are okay with what's included on their part, because it's defining what they're doing. So that's my main concern, is it's not so much like the email contact information, but essentially, are you guys okay with sort of how the things are worded here, and are there things that you don't want to see?
So
Because at the end of the day, it's your role.
Yeah.
We're
it's definitely my preference to stick with the trifold overall. As our main form, I mean, it's branded with all the different involved parties and all those things. APD's branding for the grant portion that Enfield received is missing from it. We talked about that at a previous meeting. We're gonna cover that with the mailer, so I think that's all well and good. So that's one, is far and away, my preference is to stick with the trifold. which has been reviewed by marketing professionals and has consistent branding across all of our communications. That being said, I think that this flyer is beautiful, and I wouldn't overall object to it. With a couple of edits. And those are, as I look at this, if I would be confused because it is very Enfield forward as it should be. I'd be confused why all of a sudden there's a Lebanon email and Lebanon phone number. So I wonder if you could fix that, like in the first sentence up where this is a free service. Put that it's, contracted or whatever. And we would also want to see the Lebanon Fire Department logo on.
Yeah, I don't understand. Say the last part again. So what would you like to see too?
So I think at the top where it says this is a free service, if you put something to the effect of, free service to assist Enfield residents to live in the home safely. Nurses are contracted from the Lebanon Fire Department or something like that. There's no tie, and then all of a sudden you're throwing people out of town with the email and the phone number. People are gonna pick up on that. So you have to have like some sort of explanation of why you're sending their stuff to Lebanon. I mean, you don't have to. I just think you can.
Doing. Right. Especially because the email is Lebanon.gov.
Yeah, it is odd.
Yeah.
And when they call, they're gonna call the fire department, like,
Right.
Yeah.
so I just
Yeah.
think that people do need to know that.
What it is, the connection.
Correct,
Yeah.
it's not it's not somebody from Enfield picking up their.
So with adding that in, and the other two corrections, well, I think falls in the homers, we didn't put multiple, and, that was the only wording change.
That's right. I remember that discussion.
And there was one, I think the first one to take it out, but I really strongly believe that we ought to, people who can no longer get out of their house are at high risk for other issues. So they should,
Yeah, I don't have any problem with that language.
I do have a question about who can request. This line where it says you can request for yourself, family, neighbor, and friend. What about consent? Like if someone requested for me and I didn't want it,
It
If
says-
you keep reading down.
Oh,
it
does
is,
it?
it's,
okay, consent, okay. Well, yeah,
Under how
so,
to contact. But I suppose you don't have to read the whole thing.
but I think the idea of this is to give it out to people that I'm talking with. So, if people are interested in this, they're gonna have questions and I can, just give them answers from this.
I will say though, to Afriel's point, when I was looking at this again, I think it would be a little more straightforward if we did move that bullet point up under the who can request. And then maybe under the how to contact the nurse.
Or you could just delete how to contact the nurse, really, if you move that up.
yeah,
For who can request, or I mean, this is really how we contact is this email,
right.
or phone number. So that's maybe something saying to refer referral contact or something.
So to put, those, on the right-hand side, put all four of the bullets under one heading instead of having two headings. Is that what you're saying?
The consent, right? If you're, your last bullet point under how to contact, be sure to have the individual's verbal consent if you're calling for somebody else, basically is what you're saying there.
Yes.
If that were under who can request a nursing visit.
I also wonder, sorry, if under the how to contact a community nurse, have the individual contact the nurse when possible. I kind of suspect, and it's addressed in the first person above, you can request for yourself, friend or family.
I guess, yeah, so like the first, like anyone can request and then you can request are kind of same, I guess, similar tone as the have the individual request. To me, it's just a consent, whoever
I
requests.
guess,
To me, the main point of this is whoever is requesting, if you're not requesting for yourself, you need to have the consent of the individual. That to me is the main important point, because I would not want someone to call on someone's behalf because they think they need it, and then that person has no idea, because then that can,
Well, they would be screened by the nurse, so
right,
it wouldn't
But it-
result in.
but it still
somebody,
becomes,
you know.
But that in fact
think
eats
of
up a lot of time.
Right,
Because the other thing is when the person doesn't know that we're calling them or ahead of time, they almost always think it's a scam. And then it takes a whole lot longer to actually connect and have a
Mhm.
meaningful conversation. Which is good, like people are being safe, but it eats up a lot of time.
Yeah, just a comment on a lot of the other community nursing programs. So, on behalf of Community Nurse Connection, a lot of times, often people call without getting consent of the individual. So no matter what a brochure says, that is still going to happen. And I just think about the audience for this brochure, which is very different than the trifold. And just an example, like I put the trifold up on our bulletin board, our community bulletin board, where the average age is 75 and older. What I think this brochure, what this one pager is looking for is, simpler language to put up on community bulletin boards, where the brochure has a lot of information. But I think the one pager, most communities have a simple one pager. And as Jeremy said earlier, maybe not overthinking it, but like get something simple out there. So folks, because the brochure it's a lot, it's good, but it's very busy.
I think under the, where it says how to contact the community nurse, even though right above it, it says you can request for yourself, family, friend, or neighbor. I got the impression from the nurses, that it's preferable if the individual makes the phone call themselves if they're interested and able, rather than somebody saying, oh, I'll do it
Yeah.
for you. So that was why I had 2 bullets on that and separated it out a little bit. Because then
I guess if we're
then the
trying to.
otherwise refers to the bullet above it.
Gotcha.
Yeah, I mean, I guess
Makes
if we're
sense.
trying to just give this as like, this is how, if we're just trying to advise people how best to reach, then I wouldn't even say you can contact for others. I would just say you should feel free to contact for yourself, or something along those lines. I
Well,
mean,
I think.
or
there-
combine
there's
or
probably a
making
lot
it
of
more
situations
prominent.
Where somebody will be calling for somebody else, so I wanted to have the information in there.
Yeah,
They just need to make sure they have the consent of the person.
yeah.
The more I look at it, the more I think you just leave it alone because at least it's symmetrical.
I
Yeah.
agree.
It's-
I agree.
If
It's easy to understand.
you make it all under one bullet, it won't be as pretty.
Yep,
Well,
agreed.
Okay, thank you. I
But
made
yeah,
that.
so my thoughts are just that I would say these are like, I wouldn't print so many of these. I think when we're intending to go to if there's a tabling, if there's bulletin boards that we wanna, but I wouldn't just wanna go print lots and lots of these and not have a use for them. So I think
I
I'll
think
just-
as we have, if you've identified bulletin boards, or if we've identified bulletin boards, we haven't talked yet as a committee where we'll be attending, if any events. We have only done that one tabling, so. Yeah,
But I think some language to tie it back to Lebanon and then.
Yeah.
And like I said, the fire department logo as well.
Oh,
That I'm happy.
all right.
Okay.
So moving on to program evaluation to sort of wrap up our time today. I know we want to spend some time each meeting to be able to look at these questions. How are we using the data to understand the need for community nursing in Enfield? Any salient information or salient data or information that you have noticed from the Red Cap or the MIH data? And then what kind of stories that we can use to help with, not just with Steve's fundraising letters, but also just in general for future campaigns. So,
Can I ask the data clarifying question?
sure.
Does that make sense at this time?
Why isn't July on the hours?
Oh, that was one question, but that's not what I was thinking of. But that was a question I had.
Because I messed up and didn't realize it till yesterday.
Okay.
The numbers are correct. It's 23.97. The bar graph's wrong.
Got it.
And I know this has been explained to us before, so I apologize. I get the 28 encounters summary page, and it matches the last graph, with all the breakdown of what the different encounters were, is 28 as well.
Mhm.
The Enfield nursing encounters with the blue bars, what's the difference there? Cause that's a lower number. And it's the difference between Red Cap and the nursing database, right?
Exactly.
But, and so what does that lower
Care-
number?
Care
entail?
coordination doesn't count towards those referrals.
Okay, so no care coordination. Okay, I couldn't remember.
And the reason we do that is, so that we can compare apples and apples to the paramedic numbers for the overall MIH program.
Okay. got
Jeremy,
it.
can you clarify that? Because the Red Cap data, we added care coordination so that it did
added-
match.
Yeah, we added care, well, we wanted to be able to track care coordination, but Red Cap pulls it as an encounter type. So we want, on my side of things, the paramedic side of things, care coordination are like their own column of events. So there's care coordination, that's not a patient encounter. We,
Right.
and I can send the definitions that we use back out, but an encounter is an interaction with the patient. And care coordination generally is about the patient, but not with them.
Right, and that's how we had it, but I thought we updated it to be your definition. So yeah, let's get back together on that so that unknown caller, sorry, we can have accurate, so that we can make apples to apples.
All right, yeah, I'll have Amanda touch base with you on that when she's back from vacation.
Thank you.
Did you have another question too, Donna?
Oh, well, my question about the hours, right? So that's accurate that there is just fewer hours. We didn't hit the 40 hours.
Correct.
Well, but, right.
Um,
And it's not in the bar graph, but.
it's not in the
there,
bar graph,
right.
but the number in the letter portion is correct.
It's correct. So it was fewer this.
It
this
was,
month
it
than-
was fewer this month.
Okay.
And there's a few reasons for that. There was staff vacations. There was, I was about to say that Rachel went to a conference, but that was in August, so we'll talk about that next month. There was, and moving out of the fire station ate up a lot of staff time.
Oh,
So you're not just seeing this in your hours, we're seeing this across every aspect of every service that we provide. Is that, other than emergency calls,
Right,
we spent 2 weeks moving out of the fire station.
right. That makes, yeah.
We, if you've ever lived in one spot since 1953 and moved out of it, now imagine 28 people living in one spot since 1953 and moving out of it. It was a lot. So that's, I mean, that explains why the July numbers are down. And then also, like we've talked about at previous meetings, there's the cyclical events of just home health in general. July is one of the lower months because people have been outside and they're feeling better.
Looks like there's been a sizable number of referrals.
Yeah,
We've kinda
referral-
Kicked back up.
Referrals are doing really well, and I think that's all a product of getting the word out there.
Mhm.
We'll also note, since we're talking about hours, that we're changing up how we're doing it a little bit. Rachel's now gonna work 10-hour days, and she's going to break up her week geographically. So she will spend a day in Enfield. So essentially next week, or next month, you're guaranteed to get your 40 hours because she's gonna spend 10 hours a week somewhere in town.
Great. That's great.
Oh, that's, they set up the spot for her. That's right.
They fixed the internet at the fire station.
I will make sure that they did. If she has any problems, she's always welcome at the PD.
What'd you say, at the library
At the fire
or
station?
at the fire station?
I know the library did do a draw, they did do a tabling and also talked about community nursing there, so hopefully that
She gave a presentation.
did have an
at the library.
impact. So as well for the referrals, so,
There
I
was
would say
one,
those kinds of events are really, seem to be, because that's the one thing that I know occurred in July,
I
so
know at least anecdotally, there was one self-referral that came
from
at
there,
that event.
that's
Ah,
Great.
That was an excellent presentation. I went to that. It's very good.
I do wanna, oh, sorry, Donna, are you done with
Yeah,
yours?
thank you.
Okay. Cindy, did you have any questions?
No.
One thing that came, that, you know, on this last page here where it talks about emotional support. It's quite interesting to me. So when folks are, so these interventions are more of that emotional support. So can you tell me a little bit more about how that's handled? Cause that can be, that's a like, right, what, sometimes it's just somebody may be lonely and needed to talk to somebody. There really isn't much after that, or sometimes it could be more. Um, and that's like, that's the high, I think that's, yeah, that's the highest number, or that's the highest, um, type of intervention that has occurred. So is that a trend happening? Does that,
I can speak to that because that's, from Red Cap and I can compare it to other community nursing programs. So yeah, that is the highest, emotional support is the highest. But also as a reminder, and it says on that report that the nurses can choose more than one. So it doesn't mean it was just emotional support. So they may have, done medication teaching and offered emotional support.
Yeah.
The way we talk to it about the nurses, some of the nurses are like, well, isn't just the visit emotional support? And no, we say it's more than that. It's helping with isolation and loneliness, and so everything that goes with that for emotional support. Did that answer your question?
yeah, I guess yeah, it does. I guess because I'm thinking from the perspective of marketing it to the area, if that consistently becomes, yeah, maybe it's one of many that's chosen, but it consistently is being chosen, then I'd like for us to adjust that in the community and sort of say like, are these sentiments correct? Like, you're feeling this way, the community nursing program can, like, is your emotional stress or what
Well,
you're going through preventing you from reaching out for help?
I
Right,
would hesitate to use that as a marketing strategy.
Okay.
Because we specifically say that we don't see people for primarily psych diagnosis.
got it.
Because that's not our wheelhouse at all.
So
So
if someone does have. that, then
everyone's
what?
got some,
Right.
right? And we're happy to talk to people about, we talk with everyone about their social determinants of health.
Right.
And their emotional well-being is a strong social determinant of health. And stuff that we work to address. But if they need a therapist
Yeah,
or
I'm
something
just asking
more,
if something's going
that's
on
not a reason
mentally.
to refer to the nursing program.
Yeah,
But
it's
it's-
better to use the outcomes for marketing as opposed to the interventions. But sometimes you can use the top three. A lot of times on our flyers, and actually I'll send you something we did for our annual report, is we use the top three interventions and the top three outcomes from the community nurses and put them kind of side by side.
And they don't even necessarily have to jive with each other.
No,
Still.
they often
just
don't.
give them the impact.
Okay, I guess we'll just continue to watch how this, so if someone does present with emotional, or like, let's say mental, they need really more mental health support, are they referred then?
Yeah.
Okay.
Yep.
And sometimes that's
Yeah,
why I
we'll-
think like people just need that
We'll
referral.
refer out, we'll help them find a provider.
Yeah.
The wait lists for the mental health providers are even longer
know.
than they are for primary care providers. But they'll continue to work as long as
Yeah.
it's, not a safety issue. We've had several instances, not in Enfield yet, but we've had several instances where it's been like a one and done visit bailed out because of safety concerns.
Right. Oh. Any other questions? Parker, I know you joined us a little bit. We were just going through the data.
Yeah, I've been on for the last half hour, so,
Yeah.
yeah, thank you.
Any other questions related to this, to Kristen, or? All right. So we'll just move on to other business for public comments. Yes, Dr. Boucher.
As the only public member here, I guess. I, for one, have been in this body since 1953 and have no intention of moving out anytime soon. But
Don't do it. It takes too long to move.
I echo your concerns about the right to know, questions if you're, trying to deal with business outside of, I mean, I know it's inconvenient, but, providing information to consider prior to just prior to meetings is one thing, but to be sequentially emailing back and forth with responses by multiple people up to the quorum of the committee, who are not just bordering on 9.8, you're across.
Oh, I didn't think there was any back and forth. I thought it was just.
Well, if you were talking to whoever your consultant is. With them. I was tending to, and I'll deal with it personally, make a referral, and I can't find the form to do so on anywhere on the internet.
There isn't a form.
Okay, that's fine. So there's nothing that says call this number or do anything that I'm aware of.
There is on the town website, and there was actually a very helpful recommendation as to another place to put it. I have not been able to navigate the new website system well enough to be able to cross-post it yet. But
I looked on the town website too, so if you can show me, that'd be great.
But either way, we'll take care of it.
Community nursing program, how to make a referral.
Okay.
When you go into the community nursing page, right on the left-hand bar, how to make a referral, and then it walks through.
Well, I confess that I am not particularly
You didn't.
tech savvy, so.
I think the website is
No, but-
slowly up and going anyway, so some pages had been unavailable.
Resident services on immediately.
No, and like I said, Steve had actually made an excellent suggestion to move it into, I believe, I want to say public safety or emergency services or something, like another area
Another
where it would be
area as well,
more
yeah.
visible as far as making a referral.
I will happily argue that there is no such thing as a user-friendly municipal webpage.
Exactly, and it's all
You want to
new.
be the first.
It's
But
all new. It's
also,
fun.
if you could make it searchable on the webpage.
Yeah, like if I put in like
Yeah.
community
It's the-
nursing.
Yeah, because a lot of people do
She's
use
trying,
the
it's
search
not
bar.
popping up. But
Also,
It's-
feedback from the community, how to make a referral is confusing because the community members think only a doctor can make a referral. So maybe think about changing the wording to a more consumer-friendly words.
Like,
which
how
would
can I
be-
refer someone I know?
Or-
I don't know.
That refer, so people don't
Oh,
think they're gonna refer themselves. So maybe ask your parents what button they would click on if they wanted a community nurse.
A good idea. What did you say, Jeremy? How to request a nurse?
I think
Request a
request a
nurse
visit.
Request a nurse
Request
visit.
a
And they have a
nurse visit
button.
is pretty,
I love
It
it.
just opens your.
that's
email.
pretty simple. Request a nurse visit. Yeah. I agree. Referral does sometimes really go back to a physician referral, so. Anything else, Dr.?
No, I just went back to the community nursing, on the website and I'm getting stuff related to your meetings, but nothing related on tour. So you can show me afterwards.
Yeah,
Emily, I'm sorry, I missed where you said this word Steve's, I don't know if this is important, but where Steve suggested we move it to what?
it's
What
under public safety.
Public safety.
So there's, when you go into, actually, let me see. So when you go into our homepage, here, I can show everybody.
Yeah, thank you.
There, yeah, no, this works. So under government,
Yeah.
you have, so here's our community nursing committee. So when you come in here, how to make a referral is over here on the left-hand side.
I could see that. That reads for like a
Um,
physician. I wouldn't even click on that myself.
The PDF was supposed to be there and it apparently did not move over with everything, so I'll make sure that PDF is added of our trifold.
It says it on there. the
Yeah,
trifold.
it is.
It is?
The top one, it
Yes,
says
the
community
first one
nurse
on the left.
trifold.
Oh,
Yes.
okay, all right. Well, yeah,
It'd be
I guess
cool
that's
to-
frustrating to me, because I'm like, if it wasn't apparent to me and I put it up there, then how is it coming across in
I
the
mean, it would
community?
be better
I'll work
if
on
you
that.
just scrolled down and it was
yeah.
there as an image.
So that's exactly what I
Yeah,
was kind of hoping and intended, but, I'll work on the placement so that it's a little bit more.
yeah, I can see we're under public safety.
So community nursing committee, but over here is where it was recommended to have something about, community nursing referrals,
Yeah.
which
Yeah.
I thought was an excellent
Mhm.
suggestion. So it's just a matter of, great suggestion, how do I do it? And I do have, I kind of have a collection box of questions that I need to bring to, the web form, people to get some one-on-one direct feedback with, and that's one of the things that's on my list, so.
I will say, when I just Googled Enfield Community Nurse, it went right to.
It does pop up,
So that
same
would-
too, same too.
That's helpful.
But it's-
I said
Yeah.
Enfield Community Nursing, and I didn't.
Yeah, and if you just search nurse within the webpage, it does, it's committee meeting minutes.
Yeah,
And
so
then you
that's
have
what
to
I
go-
would say.
You
in
have
the
to go all the
search.
way to the bottom to get to a spot where you'd actually be able to get to it from the search page.
Hmm. I don't know if that's something I can change, but I will look at it.
Mm.
Well, it sounds like a good next agenda is to maybe review the site and placement, because we're trying to get to folks and be accessible, and if we can have one recommendation, so it's not just like, and do this, and then 3 weeks from now, and do, maybe
Yeah,
we can
yeah.
spend, if folks can review it and give their feedback in the next meeting.
Well, and that's something that's always open, like
Yeah.
this is a part of my everyday job, like
Yeah.
I work on this for every department, so
Yeah.
it's something that if there is feedback on the website, anybody is welcome, like Steve had mentioned that, and I
Yeah.
was just like, yeah, I don't know how to, but I will make it
Yeah.
happen, and so it's not a matter of
Um,
if, it's when,
Yeah.
but yeah.
Grantham's webpage, which is pretty similar, they pinned it on their notices and announcements section. Community nurse information, and then it's just a link to the rest of the page with stuff. So it's always kind of near the top.
I've never.
I
done
will
anyone
work
else's
with
webpage.
our town administrator to see how and what can be, because there's certain things that I have access and I can kind of bump and move, but then there's other things that it would really need to go to the upper
Yeah, and
levels
then they have call and email, like right at the top, once you click on the
Okay.
link, so.
Yeah, I'll work
I
on
would
that
love,
and we
yeah,
can
and I
revisit
think
it
in
for
our
sure.
next meeting, I would love to just, for folks to think about it, I have not gone through the site, so I'm gonna go through it and kind of just.
Lebanon's is
Either-
pretty similar to
so.
what Enfield has right now, it's also a panel.
Mhm.
All right, any other future agenda items as well for the next meeting? I know hopefully Steve will be here and we'll discuss fundraising. Next step, I'm sure we'll talk about the mailing, updates as well. Cindy, you'll have a flyer version, if not before that, as well for your updates on that. Yes, sir.
One question, we're looking at the timing for the mailing. I meant to mention that before. We're about to undergo about 2.5 months of onslaught of so many political mailings that, that I presume you don't want to get lost in the middle of with throwing out the whole stack when it comes to your mailbox, to mailboxes. So that's something to consider in the timing, and perhaps may even warrant a bit of a delay.
Yes, after the election.
I think that's the plan.
That was the plan.
Yeah, that was the plan, is
So
to,
just right before Thanksgiving.
yeah.
I'm sorry, I missed last meeting.
No worries.
That's good, yeah, that's a good point.
Any other future agenda items or final comment? All right, well, it is 6:34. Anyone want to make a motion to end the meeting? Or I move to end this meeting at 6:34. All those in favor?
Aye.
Great.
Aye.
I will not. Thanks, Kristen. Thanks, Parker.
Thank you.
Thanks, Dr. Olsen. Thank you. Can't believe it's August.
I have a card in the car.
Almost.
I can't.